Hello, good morning. I'm Ani Shahabuldin, occupational therapist specialized in burns. Today I will talk about a type of soft splinting that we usually use with burn patients. When it comes to soft splinting, it means we use it after the complete healing of any types of wounds that are remaining after the skin graft. The other thing also, because there is some force as well you apply, so the skin integrity should tolerate as well the stretch that you will cause by the soft splinting. Usually after dorsal hand burn, usually patients goes in clawing position. And with the clawing position, it's mainly hyperextension of the MCB joints, flexion of the PIP joints and the DIP joints. And if there is any damage in the center slip or the extensor tendons, patients usually develop boutonniere or swan neck deformity as well. And as a type of soft splinting that patient could wear at night, you have something called flexion glove. So the flexion glove, it's a very comfortable soft splint wherein patient could wear it at night during sleeping. And the best thing with that, you can adjust it according to patient's pain tolerance. So if the graft is well taken on the BIB joints, because this is always the very sensitive joints that we are dealing with the dorsal burn, because both burn, there is no joint creases. The burn skin is usually very close to the tendons. That's why in the acute phase or the proliferative phase, we never exercise passively the BIB joints. So we mainly exercise the MCB, thumb opposition, rest, but with the BIB, better to leave it actively with patient's tolerance after the skin graft. So to show you the flexion glove, you can use either a neoprene material, which is really not expensive, and it's commonly used in soft splints generally, in neurology and pediatric as well. We use it quite a lot. So this is the neoprene, this is the flexion glove. It has a Velcro loop, non-adhesive, Velcro hook, non-adhesive, and then you stitch it there. In fact, I think they started fabricating it ready-made as a soft splint, but usually we fabricate it in our facility. So as I mentioned, you can use neoprene, or you can use the leather. But if you choose a leather, you choose a leather wherein it's very soft inside. In the inside part, it should be soft and absorbance if there is any sweating or something. So this is the way we apply the flexion glove. So you put the hand on like this. You get the part of the Velcro like that. So you block now the rest area, okay? And now you can do the flexion of your MCB, BIP as well. If patient felt pain, you can stop up to here, and then maybe 10-15 minutes when pain is completely absorbent, you can get the Velcro, and then you can even pull more, aiming on full fist. And by this way, you are doing a combined movement. So you are doing flexion of the MCB, flexion of the PIB and the DIP as well. And when we do combined movement, be sure that the skin integrity will tolerate that tension. If the skin is really fragile on the PIB joints, so what we can do, we can add a piece of thermoplastic material. You can shape it that way, Velcro at the back, and then we can stick it here. The purpose of the roll here is mainly to give comfort and pressure once you do the flexion, so you have some pressure on the palmar aspect of the MCB, and will increase the flexion. At the same time, the material is very stiff here, so it means it will maintain the PIP joints and the DIP joints in extension, aiming on flexion only of the MCB joints. So you can pull like that and then stick it up to patient's tolerance. As I mentioned, you can see here the roll here. It's really digging there in the MCB comfortably. So it doesn't cause any shear stress or any pressure there if you leave it sharp. At the same time, if you look at the palm on the thumb and whip one, you can see there that the thumb is relaxed smoothly in opposition, because that roll is opening the whip one space here. So you can see it gives me a very beautiful flexion. It goes up to 90 degrees of MCB joints flexion. You can even though increase up to patient's tolerance. The best thing with that wide Velcro is that you can manage how much flexion you want. So patient could apply it gradually. This is what I mean. This is a very beautiful way of soft splint. As I mentioned, we use it quite a lot. I hope you will benefit from that. Thank you so much.